Hi, everyone. I'm Peter Navarro. I know many of you. Some of you I haven't met. But greetings from New York, HealthRight headquarters in the United States. Today, I want to talk to you a little bit about COVID-19 and what's going on with the pandemic. And so in this brief video, which will serve as an introduction to HealthRight policies and guidance in working during COVID, I will cover the following topics. I'm going to cover the virus itself and how it's transmitted, the symptoms of COVID, how it can be prevented, how it can be treated, and what our policies at HealthRight indicate for working during COVID. So that's what I'll cover in this talk today. So let me start with the virus and transmission. So COVID-19 is a new virus. The origins of the virus are still being studied and not yet fully understood. Virologists believe that it is a zoonotic infection. That means that it's an infection that jumps from animals to people. COVID appears to be closely related to a virus that is commonly found in bats. I do want to make mention of a falsehood that has been spread about the creation of COVID. Some of you may have heard rumors that COVID was created, that was man-made, that it was created in a lab in China. And I just want to reassure you that this is false information. The overwhelming consensus among virologists around the world is that this is a naturally occurring virus. And the reason that they know that this is a naturally occurring virus is because given what humans are currently capable of in terms of virology and genetic engineering, there's nobody who would be capable of creating a virus that looks like this. And so I just wanted to dispel this myth that the virus was created in a lab. Again, virologists around the world have concluded that it would be impossible for a human, given what we know today about virology and about genetic engineering, to create a virus like this. So with that, let me shift to the issue of transmission. How do people transmit COVID? COVID-19 is an airborne virus, and that means it lives in droplets that float in the air. It is transmitted when an infected person expels the virus particles in the air when they talk, when they cough, when they sneeze, when they sing. And so if you are in close contact with someone who is infected, and by close contact, I generally mean within 1 meter or less, then you may be exposed to the virus. I should also note that COVID can live on surfaces, and therefore it can be transmitted by touching an infected surface and then touching your face. However, I should also note that infection by this route, from a surface to your hand to your face, is much less likely than catching it through the air. Finally, in terms of transmission, I want to note that some people are asymptomatic. They are infected with the virus, but they do not show symptoms. Nevertheless, those people who are asymptomatic, infected, but without symptoms, can still transmit the virus. Which brings me to symptoms. So if you are exposed to the virus and you become infected, the most common symptoms of COVID-19 include fever, a dry cough, sore throat, and a loss of smell and taste, and shortness of breath. There are other symptoms of infection. These are just the most common. Most symptoms will occur within 14 days of exposure to COVID. It is possible, as I just mentioned, to be infected with COVID, but not have symptoms or have very mild symptoms. What we know from the virus so far is that approximately 80% of cases are what we would consider mild to moderate, and about 20% are severe. And COVID can be fatal. People with underlying conditions are at greater risk. Underlying conditions including things like obesity or cardiovascular disease, or the people who are immunocompromised or who have other co-infections are at greater risk for complications, more severe disease, and potentially death. The elderly are also at greater risk as they have weaker immune systems. The COVID case fatality rate, which is the ratio of deaths caused by COVID to the number of people who are infected with COVID, varies from place to place. And it depends on many factors, including the quality of care that people who are infected receive. But COVID is, everywhere you look, significantly more dangerous than the flu. There are also rumors going around in social media and on the mainstream media from time to time that COVID is like the flu. It is not like the flu. It is significantly more dangerous, and the case fatality rate for COVID is significantly higher than the flu. For example, in the United States, the Centers for Disease Control estimates that 35,000 Americans died in the last flu season in 2018 and 2019. However, since March of 2020 in the United States, COVID has killed more than 200,000 Americans. And frankly, this is likely an underestimate of the total number of deaths due to COVID. And bear in mind that those 200,000 deaths occurred despite the fact that the United States was locked down and people have been taking precautions for many, many months. So without preventative measures, we know that millions of Americans would have died already. And we expect that because some people are not following guidance, there will be many, many tens of thousands of more deaths here in the United States. So it is simply not like the flu. The case fatality rate is significantly higher than you see with the seasonal flu, even in a bad year. So with that, let me move to how you prevent COVID infection. The first way to prevent it, and the easiest way, is to keep distance away from other people during this time. That can be very hard, particularly with loved ones, but the best policy is to create a group of people, probably your family, who you can interact with, and minimize your interaction with people outside of your immediate family, the people that you see every day. When you interact with other people, you should keep a minimum of 2 meters between you and the other people. So keeping that distance is very important. You should, when you're in the presence of other people, you should always wear a mask. And you wear a mask for 2 reasons. First, to protect other people from you. Remember, I said you can be asymptomatic and still transmit the virus. At any point in time, you might not be sure that you're not COVID infected, and you wouldn't want to transmit the virus and infect somebody else. By wearing a mask, you reduce the amount of viral particles that go into the air from your breathing, coughing, sneezing, or talking. You also wear a mask to protect yourself from other people. But really the primary reason that you wear it is to protect other people from yourself. But it works both ways. You wear the mask to protect yourself and to protect other people so that you're not responsible for viral transmission. The third thing that you must do is clean your hands. You wash your hands regularly, or you use disinfectant that has a hand sanitizer that has more than 60% alcohol in it, and that will kill the virus. You should also try, it's very difficult, to avoid touching your face. As I mentioned, one of the routes of transmission is to touch an infected surface and then touch your face. If you touch your eyes, your nose, your mouth, then you can inhale the virus and become infected. So if you wash your hands and you don't touch your face, you reduce the likelihood of transmission through that route. You should avoid all large groups, period. All large groups should be avoided, and you should avoid indoor activities. The virus spreads more easily in indoor areas because there's less air circulation, and that means that the virus is less likely to be disturbed. If you're outside, there's a lot more air circulation, and the virus is mixing with more air, it becomes diluted, and it moves around a lot faster. So outdoor spaces are safer than indoor spaces, but you should avoid large groups indoors or outdoors. And again, if you're in the presence of other people, you keep a 2-meter distance and you wear a mask. Next, if you're feeling unwell, you should stay home. And if you start to have what you feel are COVID symptoms, the symptoms that I mentioned earlier, shortness of breath, dry cough, sore throat, fever, loss of taste, loss of smell, then you should call your doctor and potentially go get a test. But the first thing you should do is call your doctor and wait and speak to your doctor. Finally, I want to encourage everybody to get a flu shot this fall. Epidemiologists and doctors are very concerned about flu-COVID co-infection. These are different viruses, and they're concerned that together they could be particularly hard on particularly people who have underlying symptoms and who are more vulnerable to infection. But it could be even with somebody who has a fully functioning immune system, they're worried about the co-infection. So get a flu shot in order to reduce the likelihood of getting the flu as well. The final point that I'll make on vaccines, on prevention, is about vaccines. Several vaccine candidates are currently being tested. One vaccine candidate has moved to phase 3 trials, which is the second to last stage, typically in clinical trials of new pharmaceuticals. So things are moving. There are no candidates that are immediately available for COVID, and honestly, the best case scenario for a vaccine being available is that they would identify an effective vaccine or partially effective. The vaccine that will come out is very unlikely to be 80 or 90% effective. It's more likely to be 50 or 60% effective. And that means that not everybody who gets it will be 100% protected, but it will reduce, if you get the vaccine, it'll reduce the likelihood of you getting the virus and then transmitting. So it will reduce the virus in the population. But the likelihood that there's a virus, that there's a vaccine ready before the end of the year is low. I think it could happen before the end of the year. We'll wait and see, but that's really the best case scenario. And just remember that once a vaccine candidate is identified, it takes a long time to manufacture the vaccine, to distribute the vaccine, and then to get it into people. So I think, honestly, we are going to be living with COVID for a very long time. First of all, we're going to be, even once a vaccine comes available, we will be living with this disease. Because it's going to be very difficult to eradicate. Everybody is susceptible to it. Nobody has immunity to this disease. And because it's in the air and anybody can get it, everybody is vulnerable to infection. And so we're going to be living with this disease for quite some time. But I think it's going to be a good year before things, best case scenario, before things start to get back to normal. Because again, it will take time to identify the vaccine candidate, to manufacture the vaccine candidate, to distribute the vaccine candidate, and then to get it into people. So that's the status of the vaccine. And I'm happy to answer any other questions about the vaccine that you might have. As far as treatment goes, there is no specific treatment for COVID infections right now. Doctors are providing supportive care and treating symptoms. The final thing I'd like to talk to you about today excuse me, is about working during COVID and what HealthRight's policies are. Within HealthRight, I assembled a team across the organization to become a COVID task force. And the job of this task force was to review all of the available information about the virus, about preventing the virus, and best practice for workplaces, and come up with a set of guidelines that we could implement across the organization with the goal of keeping our staff safe and keeping all of our clients and our partners safe while we're working. And so that guidance, there are 2 guidance documents that should have been made available to you, phase 1 and phase 2. And I urge you to make yourself familiar with those documents. The guidance that is in there, and there's a lot of detail in that guidance, I'm only going to give you the highlights today, are very important and have been very thoughtfully considered for our particular circumstances, given the work that we do. So I encourage you to review that guidance. And if you have any questions about the guidance, please ask your country director or ask the COVID task force representative from your country. As I said, the guidance documents, there are 2 of them, are very detailed. And so I'm only going to cover the basics here today. So let me start with our current policy. Our current policy around working is that everyone who can work from home should work from home. If you don't have to go out into the community and you don't have to go to the office, then there's no point in taking the risk. If you can work from home, you should work from home. All right, so that's the first thing. The second policy that I want to emphasize is that masks must be worn when you're working, with a few exceptions. If you're in the presence of other people, if you're in the office for whatever reason, or you're in a meeting, or you're out in the community, you must wear a mask. That is our policy. Everyone is required to wear a mask. Again, it is to protect other people, and it is to protect you. Anyone not complying with this rule will be disciplined, and the country directors have all been told that this is a non-negotiable rule. Now, when you're in the office and you're seated at your desk, then it's okay to take off the mask. And if you're outside the office and you're going for lunch and you're having lunch, I encourage you, while the weather is still warm, if the weather is warm where you are, you can do it outside. I would encourage you to do this outside, but keep a distance, keep 2 meters between yourself and anybody else. If you are convening a meeting on behalf of HealthRight, then all meeting attendees must be wearing a mask as well. If they don't wear a mask, you tell them that it's HealthRight policy. And if they refuse, then they cannot attend the meeting. You just say, I'm sorry, this is our policy, and people who don't wear masks are not permitted to attend. You need to hold meetings outside if the weather is warm and you can hold a meeting outside, you should hold a meeting outside. It is lower risk. You must still keep the 2-meter distance, but you should do it outside. You should try to shorten meetings. The less time you're in the presence of other people, the lower the risk of transmission. So if you have a 1-hour meeting, try to cut it to 45 minutes and really stick to business and move it along. Keep meetings to fewer than 10 people. Meetings should not be large. Again, no large groups of people. The more people in a group, the higher the risk, the higher the likelihood that somebody is going to have COVID, and the higher the risk of transmission. So keeping meetings very small as you possibly can, only essential people in meetings outside, shorten meetings, masks must be worn. You should wash hands regularly. All of the prevention guidance that I gave you earlier should be followed during work hours as well. Finally, in terms, if you need to go into the office, then country directors and associate directors of finance and administration are managing work schedules for people who need to be in the office. You need to signal to the associate director of finance and administration that you need to go to the office, and they will manage the work schedules. We're not allowing everybody to be in the office at once, so the people in the office will be carefully managed, and only a limited number of people will be allowed in the office at the same time in order to ensure adequate space around workstations. Again, if you're sitting at your desk and you're far away from people, you can remove your mask. If you're up and walking around and circulating within the office, then you must wear a mask. Because this is a new virus, we will continue to learn new things, and some guidance may change. This is normal as we learn more. But for now, the guidance that I've covered in this video details how we will continue to work together and to keep each other safe. We are responsible for each other's health right now, and so I thank you for your cooperation. Finally, I know many of you may have questions about the virus. There's a lot of information floating around. Some of it is good, some of it is not good. So please feel free to email me with any questions that you might have, or alternatively, contact Helena, send her your questions, and maybe she can gather up the questions and send them all together to me, and I can answer them by email. And so I'm happy to answer any questions about anything I said today or anything else that you've heard about COVID. If you have any questions, happy to answer those. And if I don't know the answer, I will get the answer for you. So at this point, I'd like to thank you for being part of the HealthRight team, for the great work that all of you do, the incredible work that you do with marginalized communities that are lacking healthcare access and who suffer a disproportionate burden of human rights violations. I'm proud that you're all on the HealthRight team, and I look forward to seeing all of you in person one day soon. I'm afraid it's not going to be until well into next year, but as soon as it's safe to get back into the field, I promise you I will, and I look forward to seeing all of you then. Thanks, and be well.